Our health service was not designed for the pressures now put upon it. The people with chronic illness, the frail elderly, the sheer number needing care. So here in Ealing, West London, health bosses have a plan for radical change to ensure the NHS can cope. But it will mean scaling back services offered at the local hospital. The plan to redesign NHS services in this part of London has concluded Ealing is simply too small to offer the complete range of hospital care. Instead, what's proposed is it'll still offer most of what people come to hospital for, like day surgery or outpatient appointments, but not the specialist stuff like major operations or intensive care. In fact, the maternity unit and the children's ward have already shut.
It really is turning into a movement. People are very, very angry.
The proposals have met with fierce local resistance.
This is a massive cut. They're going to get rid of almost 250,000 outpatient appointments, reduce capacity for A&E appointments by almost 60,000. It's absolutely massive. The out-of-hospital services which they say are going to replace our hospitals are window dressing.
The plan here is one of 44 different proposals for transformation covering England. They aim to treat people closer to home rather than in hospital, with specialist treatment centralised in fewer hospitals, all of which should mean the number of hospital beds can be cut. But today came a warning from health experts.
The biggest concern is there isn't enough resource to invest in community services before the changes to hospital care are made. It would be a big mistake to start closing hospital beds without a prior investment in GPs and community nurses.
However, doing nothing is not an option. In Ealing, for example, no change would drop the local NHS £1 billion into the red. Even so, Ealing's council leader says he will back how the public feels.
As I go out and talk to my residents, regardless of political affiliation, frankly, tell me that they think these proposals are crazy, they don't agree with them, and as a politician I have to reflect that democratic message that's coming through, I have to say, very loud and clear.
Local authorities are meant to be partners in this change process, but they are answerable to local people. So for these plans to succeed, everyone must be persuaded. Catherine Jones, 5 News.